Viewpoints on Marino World Online. I am Lynn Bacani. Let's talk about holistic care in maritime with Dr. DIDOY LUBATON, Medical Director of NMC or Nordic Medical Clinic. Welcome to the program, Doc.
Such a pleasure, Lynn. Thank you for inviting me.
Okay, so please tell us about Nordic Medical Clinic and how is it different from other maritime clinics?
We have a holistic approach to health, meaning we look at the person on a whole being perspective. We look at the person's not just blood tests, we also look at their lifestyle, we also look into their relationships and all the other aspects of life that forms the human being. And we take care of people from shore to sea. And so the care is continuous wherever they are. And that's basically what we do. We promote holistic health education during their PME and throughout their activities with us.
And of course, I was there during the launch in January 24, 2018.
It was such a long time ago, but it's still also a short time for 3 years. And what an incredible journey we've had so far. And just to update you, Lynn, we have been able to take care of 40,000 seafarers so far, and we're happy about that. And it's growing every day. So we're looking forward to take care more of our customers and their seafarers.
Of course, your first client is OSM Maritime Services, right? So how many manning agencies do you handle now, or do you serve?
We do a lot of services from PayMe to COVID testing to drug testing to telemedicine, and we're serving about 20 key customers. But some others, we're going to 20 to 40 key customers so far. So it's really nice that more companies trust us with the healthcare of their seafarers.
Doc Dido, especially now that we are having this pandemic, how important is holistic care to our seafarers as well as their family?
Oh, definitely. The pandemic has brought us into understanding the COVID physical virus, but we understand as holistic doctors that it's not just physical, it's also psychological. So we're very high as well in giving psychological first aid, mental health, well-being talks, and connections with our seafarers. And we have been really seeing people getting distressed on board. How many months that they are extending their contracts, they're missing their families, there's piracy going on, there are still injuries and illnesses happening. There is lack of healthcare access while they're at sea, especially because of travel restrictions. They are already near the port, but they cannot go inside the country because of that problem. We have been able to get in touch with our seafarers and do counseling with them, help our captains to make better decisions, especially if it's a life and death or really preventing the worsening of the situation of the seafarer. And that's what we do. From all over the world, we're grateful that we get to do it.
So you're doing telemedicine on board?
Yes, yes. We have launched it since the pandemic started. We formally shared the service April 1, 2020, and we've had more than 300 cases of calls and 300 cases that we've been able to help our vessels. You know, it's when you're out there at sea and there's no immediate healthcare access, it can be really scary. It can really be daunting as a task for the master or the officers on board. And especially if the seafarer is going through mental health distress, when the person or the seafarer is not coming down, when there are fights going on the vessels, when the person is anxious, what if there's COVID or at least symptoms going on? What do we do? So the point of care, of contact through calls, through video calls, through emails, depending on what's available. I actually had the chance, Lynn, to call a seafarer every single day through satellite because this seafarer is going through anxiety and depression while on board. And the seafarer is so grateful, and the master is so grateful, the customer is so grateful because we were able to at least prevent loss of life or an injury or or it's not just the seafarer, it's also the rest of the crew within the vessel that you need to take care of. When you take care of one, you also get to take care of everyone. That's holistic care.
And for our women seafarers, especially those on board, it's Women's Month now. What can you say about their health now? They're also affected by this crew change crisis.
Oh,
What would you advise?
definitely. Women are much more nurturing, and they're
Mhm.
also looking forward to their families. That's one of the things that we've noticed with women seafarers. They are really trying to prove themselves well on board, but their minds are also thinking for their families. How are their families eating? How are their families doing? Checking on the school progress of their children, and it's such a I honor women in maritime, especially our seafarers, because it's not an easy task. But I can agree with you. There is a huge role for women and their nurturing attitude, and yet they're still brilliant. There's no supposed to be difference between men and women. Any man, any woman can do the job, uh, and is qualified. And we here in our clinic, we don't check if you're a woman or a man. Well, in physical examination, there's a huge difference at least, but we treat everybody as is, and there's no discrimination. That matters to us as well.
What else can you say about mental health on board,
What I can
especially this time of pandemic? What can we do? Is the companies, from the ship owners to the manning agencies to the families.
Yeah, you said it right already, Lynn. You enumerated the different stakeholders for this one. I can say we have to work together. We really have to work together to, help each other. I can say that we're better together. So, for example, Lynn, we were able to do vessel town halls. I was with the manning agency, and they updated about their salaries, about their setup, about reassuring that you will not lose your job. And then I come in as a mental health advocate and as a healthcare provider. And then there's also free access for their seafarers, extended bandwidth for them to call and have internet access to be in touch with their family members. And then we made ways so that people on the ships, stranded on the ships, could go home. So the mining agencies did some, chartered flights from wherever they are. They brought them home, and we were also the ones who did the COVID testing, so that the usual 7 to 10 days, we brought it down to 24, 48 hours, and they can eventually go home. So it's a mental health is a whole thing. It's not just one action and then it's all good. No, it's a consistent awareness, and it's also consistent all of us putting together our efforts so that we could address the growing concern. Really, seafarers, and not just seafarers, including you and me, even the manning agencies, the crewing operators, everybody's so stressed out. So instead of look pointing fingers, I would like to say that we have found the joy of trying to make solutions. Everybody wins. So win-win-win solutions are the best for us at this time.
So communication is really the best thing to do right now.
Definitely communication. And if I may add to that, Lynn, it's authentic communication. Really, when we commit to something and follow a deadline, we do that. When we say we're going to give more time for seafarers, they really get that time. If we give them opportunity for healthcare, really ensure that they know that they can tell the captain anytime and they can call us anytime as well. So it's really authenticity. Lynn, in our counseling sessions with the seafarers, it's either face to face or most of the time through calls now, through telemedicine. 80% of the time, we're just listening. We're just allowing them to express themselves. And they really get to say whatever they want to say, what's in their heart, what's in their mind, sharing their fears, their weaknesses, what they are really concerned about. And then we just listen to them. And you know what? 20% of the time, we just give some directions, reassurances, and tell them some facts and details. But it's real, authentic communication. And people really know if they are being cared for, if there's real concern and care for the seafarers. They will know and they will give that feedback to you.
Could you share with us I think, what do you think are the common problems they're encountering now, or what are they telling you?
Well, number one, it will never go away. It's job security. People are still asking, are we gonna, am I gonna lose my job, or will I have this job still? For example, the passenger segment had a hard time how to reassure them what to do, and there are solutions. I know of some principals or companies that allow the seafarers loan. That's their way. That's their style. Some people would have different ways, creative solutions for that. But primarily, job security number one. Secondly, family problems, and they because they're so far away for a long time without no assurances when they will go home. It becomes increasingly problematic for them because things are happening back home and they're not yet here, and sometimes they want to at least help the family be in control, but they're so far away. So losing that ability to be in touch with family is also a hard thing for them. So at least for me, it's from my practice, from our team's practice, it's job security and family distress. That's why, Lynn, when we take care of our seafarers, we also take care of their families. When we give holistic health education, in one company, I'm giving a weekly show, or at least a weekly update to our in Facebook, where it's a close group for families of the seafarers and the actual seafarers themselves. So we give them health updates, we give them what to do, what not to do, how to take care of each other, how to take care of oneself. So at least involving the family. When you take care of a seafarer, you don't just take care of the body of the seafarer, you also take care of their being. But if you want to be more holistic, you also take care of their families. And when you take care of the families, the seafarers would have that peace of mind, and they will also learn to take care of themselves. One less thing to worry about, or at least they got some help from us.
How about those repatriated seafarers? Have you encountered them? Have you talked with them?
Yeah, definitely. I myself was able to go to the hotels where they're quarantined. We were swabbing them, and in the process of filling up the forms, etc. Sometimes we'd have some small talk, and they will tell us about how grateful they are. They are being taken care of this way. But sometimes when we see some red flags, we also take note of that and align with the manning agency and tell them about that person's situation and ask permission. Can we get in touch with the seafarer so much more? Can we have calls with that person? Could we invite this person to the clinic so we can run some tests, have that person talk to our psychologist? So we do that. And then there are people who gets positive, about 2 to 3% positivity rate. So one thing that is good also is don't just test your seafarers. You also support your seafarers after testing. So when it's negative, we help seafarers to go home. We give them opportunities for transportation, and we align them to have good quarantine facilities. But those who are positive, we also provide counseling. We also get in touch with them. We sometimes it takes a doctor to explain fully what the test means because they're really so afraid. They're so fearful for their situation. And so we give them reassurance, we give them the facts, and most of the time our conversation is answering their questions. And real authentic communication, it's there because they're beginning to really ask their deep questions, and they're sharing their fears, and they just want to hear it from a professional. So we thought of why not just really offer ourselves there. So we've expanded our team because of our growing number of seafarers, and it gives us real joy when we see seafarers giving us feedback and say, best team ever, thank you for this. And the company is and the customers of the company are really giving us recommendations as well. And I think real authentic care, is being felt. That's why we are seeing growth, in our companies. Our customers are the ones talking about us, and we're grateful for that. So in this opportunity with you, Lynn, I'm thankful that we get to share a holistic approach to our maritime healthcare.
From those seafarers who were tested positive of COVID-19, and then they got well, back to work.
Very, 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 very good. When I say that, success stories, recovery rates are very, very high. Yeah, in the whole population, it's just a few percentage, 1, 2, 3% of those people who would have mild, moderate to severe cases of COVID. It's really not a physical thing. It's more of the psychological and mental health. Uh, Seafarers are so afraid if they will die. I haven't seen my family yet, but I'm positive, so I'm scared of this one. So success rate, we are in touch with LGUs, with the mining agencies, and we're taking care of our seafarers. And as so far, what we've from the feedback of our companies, we don't have seafarers dying in the quarantine facilities. They are all given help. And we have also given that recommendations to them that you don't just release them after 10 days. We really give the recommendation, please retest them and make them negative before they are sent home. Because that's also a negative test while going home is also given as a reassurance to the family that when the seafarer goes home, he's not infectious and he's not COVID positive, and that takes care of the family. Some just follow the 10-day quarantine and then they're gone. They get to go home. But what we recommend to our companies, and our companies are actually doing is before they send the seafarers home, they retest again until it's negative. And it's also very reassuring for the seafarer.
So you also have the testing lab, COVID-19 testing lab inside the NMC clinic.
Yeah, we are the facilitators of the COVID testing, RT-PCR testing. We have partner molecular laboratories, three major ones. And what's good with us is we really, we know the operational knowledge about this. We know how critical it is to produce results in a certain time. We know that this one is for this particular situation and for this vessel. And that's one of our main thing as well. We thought of trying to build molecular lab. And then early on, we decided, no, we don't want to build a molecular lab. We'll just focus on giving the service to the seafarers, since there will be good molecular labs out there that we can partner with. And that has been a good success for us because our focus is the seafarer. It's not on the testing itself. It's not running a testing facility, but it's allowing the service to reach the seafarers for their particular concerns.
For the physical,
Yep.
physical. It's good to exercise, of course.
Yeah, it's part of our pre-employment medical examinations here that even before you go to us, you get to watch 10 sets of videos, just 2 to 3 minutes each as a holistic health education. And we talk about the basic things there as a human body and a human being. We talk about how to get good sleep while on board or at sea or here at shore. Or we also talk about nutrition because nutrition matters. You become what you eat, what kind of food. I know sometimes there are limitations in the food that you eat there, but it's not just about the food, it's also the attitude. So we share that sleep, nutrition, exercise makes a huge thing. Water intake is a good thing as well. And you know what, in terms of COVID situation, it's our immune system that will be the one to really fight it. It's our first line and actually the last line of defense as well. We can have different recommendations. We can have vitamins, definitely. Quarantine helps. But if a person is immune deficient, if a person's immune system is actually weak and low, you will have higher chances of getting sick. So that's what we remind our seafarers through various ways, through health talks online, through their counseling. You know what? After our PEME, we actually doctors actually call our seafarers. We send them an email of their findings through an email and it's discussed in detail there. But we took a step further. Our doctors call each seafarer up and say, these are your findings, sir. Do you have any questions? And by the way, please refer to this page number because we also give them a health booklet so that when we discuss their findings, they have a resource. And that's how we try to do our holistic health education. And so far, good news about us. We're successful with one of our clients. You know, it's always a maritime group that is our sister company. We were able to bring down 50% of their medical repatriations in the last 3 years, and that's huge. And for us, for some people, it's money, it's numbers, but for us, those are lives. Those people could have been sick. Those people could have had very bad problems at the in the vessel. But these guys are in a much better shape. There are no cardiac events, no heart attacks on board so far for everybody that we did for PEME, because we try to mitigate the risk while they are here at shore, so that when they're out at sea, they would have less of a problem. And if there is a problem, they can get to call us because of our telemedicine services. So that's a holistic approach.
At a time when the world stopped, ships kept moving. People still shopped, ships kept on proving. The volume of trade that's moved by sea, 90% of trade, actually. Crops that are weighed, cars that are sprayed, and it's easy to see the impact this makes. Fruit and vegetables, toys and collectibles, wheats and grains, the blood in the veins. Like to land a farmer is, ships are to the sea. And if the world is the heart, ships are the arteries, which stock the pharmacies, move essential commodities. So there's a lot at stake across these seas. Without these routes, half the world would starve, while the other half would freeze. Without these bright-coloured containers, the four walls in our house that contain us would be empty. The books we read, the animal feed, the oil we need, the global lives that we lead. No oil, no cars, no essential spare parts. The sea's version of stars, those flickering lights on the horizon. By moon and by sun, but the journey is never done. As a supertanker proves, the distance it moves is equivalent to 3 times around this earth a year. And we are served by over 61,000 ships. The things we buy, the things that shops sell, the 1.7 million seafarers, it's more than just engines that propel this industry. And it's easy to see that a lot is owed to the people that load. 6,000 ports worldwide, but it's not all plain sailing. It's rough seas and piracy warnings and the change that this inevitably causes. The sea covers 70% of our planet, so you can see why we need to plan it. A global community of knowledge and passion. From salt and sugar to the latest fashion, our ships keep moving products we love using. Ships make the world go. They help trade flow and let business grow.
How are you operating amidst this pandemic? How about the protocols implementation in your office?
That's a very good challenge for us. We actually closed for a few weeks when the ECQ started last year, but we resumed last May, and we ensured that health protocols are in place. We have managed to put social distancing. We put in some layers of protection like ventilation, air filters. We put hand washing or alcohol dispensers all over the place. But most important for us, we also, expanded our operation areas, meaning not just inside the clinic, but we also went outside. For example, COVID testing are now being done more in the hotels. Instead of them going here, we go to where they are so that we keep our seafarers safe. And that has been our call to our manning agencies. And it's so good because when we recommended that quarantine and we just test at the quarantine facility, uh, that was the start of different mining companies adopting that. And we're grateful that we get to influence the industry at least for giving them the health protocols and really acting upon our recommendations. And we are operating 7 days a week. We have expanded our office. We had our a bigger office on another location, at least inside the building, to accommodate our telemedicine services. Our people have grown from 15 to 50 people, and we have expanded our networks so that we don't just do it on our own. That's why we focused on giving the service instead of building the molecular facility. So it has been crazy, challenging, but it's so rewarding and meaningful. We're very conscious of that, and I'm happy to report to you we're also going to build one, hopefully in Cebu, within the year. We're on it so that we can expand the holistic service, not just here in Manila, but also in that area, that Visayas and Mindanao area.
Doc, let's talk about COVID-19 vaccination. What are your thoughts on this?
COVID vaccinations is essential for seafarers. We already have seen the bill. I heard it from the Marino World
Yeah.
News that you presented, that live that you have. I saw that there's a bill that requires seafarers to be vaccinated before they go on board. That's
Yeah.
it. That's the end game. If that gets passed, we have no choice. And I really fully support that seafarers are key workers and they would be vaccinated early on. And so, at least for our side, we have managed to get in touch with many companies, putting together our efforts so that vaccinations would really happen. We have something coming up by July for massive rollout of vaccinations and supply coming to us. We would be the administrator and the storage facility, and it's very crucial because it's not just the preventing the risk of loss of life, but it's also the livelihood of the seafarers that is at stake here. And so hopefully we get to work together so that vaccinations are in place and sustainably so. If I would just recommend, please don't just do the vaccinations on your own. You need to have a good medical team to do it. Why? Because there are cases that do happen for anaphylactic shock, medical conditions. You have to be able to be very careful in administering them. And once side effect or adverse effects happen, there should be a ready team of doctors and emergency personnel and a partner hospital just in case. Us in our team, we don't say that it's not an if it will happen, it's when it will happen. So we have a few months or a few weeks and months ahead to prepare for that. And when the massive rollout begins, hopefully by July, then we can make it sustainable. So we're looking forward to that. And at the end of the day, it would be good for our seafarers and their families.
But do you think it should be mandatory to our seafarers?
That's a very tricky question, Lynn. I don't see the need that we want it to be mandatory for now because it's a crew change crisis that will happen. Why? Because the supplies of the vaccines are limited. It's not going to reach our shores very early on. So if we mandate it for our seafarers with lack of supply, there's going to be a huge difference and a huge vacuum. And people will suffer, their families will suffer. What I suggest though is instead of making it mandatory, really make ways to make the vaccinations happen. And once we've got good sustainable vaccination program for seafarers, that's when we can push for it. But not within this year, not maybe early on next year, but once we have fully established it, then let's talk about making it mandatory. That's at least for my side.
How about the different types of COVID-19 vaccination? What can you say about this?
Yeah, so many different types. What we have here in the Philippines so far that is rolling out is Sinovac from China. That's a brand of vaccine that is 50 or plus percentage effective. We also have Moderna, AstraZeneca, Pfizer, and Pfizer and Moderna is a new technology, mRNA technology, where the body gets the message and just makes the, programs the cell to produce antibodies. We have Covovax coming up, which is a protein derivative. I can discuss more and more and more about this, but the point is the vaccines are safe. Number one, although we don't know the long-term side effects yet, because that's a disclosure, because we haven't seen full rollout to millions of people for a long time. So that's something we're watching out for. But any vaccine is better than no vaccine at all, at least for the seafarers. I've already talked to customers, ship owners, and say they want their seafarers to be vaccinated before they get to be on board. And I'm the one begging them, not yet, because we don't have the vaccines in the Philippines yet. So please, and they would say it doesn't matter whatever vaccine, we just want them vaccinated. So yes to vaccinating our seafarers, no to mandatory, and whatever vaccine we can make it sustainable, good. One good note lang, Lynn, one good thing to note, in terms of operations for maritime, the one dose vaccine of J&J or Janssen would be the good for us. So because it's hard to have two vaccines, two doses, because it takes about 21 to 28 days, which is the best time to give the vaccines. And for a seafarer to get on board, that person would have to wait for a month before being able to fly or being embarked on a ship. And the planning of operations should be 2 to 3 months ahead. So it gives an impossible, tremendous task for our crewing companies to do so. So at least the vaccines that are available, we roll it out. But if and when the vaccines would be improved and it's only one shot, that would be the best that could happen for us. But again, we're not yet there. We're looking forward to do so. We deal with what we have, and we try as much as we could, putting our efforts together.
But can you still carry COVID-19 after vaccination?
Yes, Lynn. It's not a 100% effectivity, Lynn. And also, it matters that you complete the 2 doses, at least for the 2-dose vaccines. Because some people now, I am seeing it now, that once they're already vaccinated, they feel invincible. They're not wearing masks anymore. But actually, if you haven't completed the 2 doses, you are, and it also takes about 4 to 6 weeks before you can produce enough antibodies to protect yourself against COVID. And it's not a 100% thing. So yes, people can still be infectious, not because of the vaccine, but because of the exposure to the COVID virus itself, even when you have the vaccine. It takes time for the body to produce antibodies because of the vaccines, and it takes 2 doses to complete it, and it's not 100%. So it is another layer of protection, Lynn, but it doesn't say it's the cure. It says we have another layer, and the quarantine, and then the testing, and then the physical distancing, and then the mask wearing, and then the hand washing. Put those layers together, the virus would have a hard time coming through. The vaccines adds an extra layer of protection and peace of mind, but it's not the solution. The solution is us. It's our behavior. It's us adhering to the health protocols. That's what we remind our seafarers to.
Very interesting conversation with you, Doc DIDOY. Of course, your final thoughts and how can they follow you, our audience, those who are still interested to ask you some questions about COVID-19 or holistic health care.
Lynn, thank you for this opportunity. It's such a pleasure that we get to introduce the holistic maritime healthcare for our seafarers. And anybody watching out there is hope. And I would say that we're better together. We're doctors. We want to remain doctors. But you guys are doing your job and do it very well. But if we put ourselves together, our collective combined efforts from seafarers to manning companies to PNI to us in the PEME clinics, if we put ourselves together, we know what we want. We all want the same thing. We want each other's success. So your success is our success, and our success is your success. And hopefully, this is what we've seen, Lynn, that the maritime sector is putting themselves together. We're becoming more solid. We're communicating more often. We have united stands, and that's a good progress. Hopefully, health also, health people would also be part of the conversations, if I may say that. And I'm happy to report to you that more calls from the international community are reaching us. Why? Because they're now recognizing it's a medical situation, it's a pandemic anyway. So medical professionals should be part and be on board the discussions determining the lives of the seafarers and what they represent. And you can always reach us at our website, nordicmedicalclinic.no. So you can reach us, and I look forward that we get to work together. Lynn, thank you for this opportunity.
Thank you so much for the time and thoughts, Dr. DIDOY LUBATON, Medical Director of Nordic Medical Clinic. Thank you for watching Maritime Viewpoints on Marino World Online. I am Lynn Bacani.